Okay, guys, hey, this is Andy again, and we're still right here on page 1187 in your book with some really good pictures here. That's why I'm hanging out so long right here. So, in this complication, this one is known as abruptoplacenta. Now, it's referenced in your book right there in that second column, abruptoplacenta. And as we look at the picture here, we notice that the fetus seems to be developing normally, and you see that the placenta is up here at the top. And for some reason, the placenta has become torn or separated from the wall of the uterus. Now, one of the ways this could happen would be traumatic injury, perhaps a car wreck or a fall, or maybe even abuse. So it might be something you might want to look out for, signs of abuse. But also with this, it could be because of the pregnancy-induced hypertension. So remember, that was related over on the other side of the page, back up here with preeclampsia. So with that hypertension, it may never progress into eclampsia, which we already know is the onset of seizures, but it could cause abruptoplacenta. Okay, just the hypertension alone could cause abruptoplacenta. So it's very likely that hopefully your patient has had prenatal care and that they're receiving guidance on how to treat their blood pressure. They may even be on bed rest. But remember, that's only someone who is at a high risk with the hypertension. This doesn't mean that someone can't have a car wreck or a fall with a perfectly normally developing fetus and have this condition happen. Okay, so you will. This is a true emergency as well. You need to treat for shock, watch for signs and symptoms of shock, and it says up here on the top of the page on 1188, it says with the abruptoplacenta, they often report severe pain. However, vaginal bleeding may not be heavy. She also may be present with vital signs with a shock, rapid pulse, and pool, clammy, and diaphoretic skin. So the bleeding, as it's describing in your book here, and I'm going to go back and reference the picture again. The bleeding is actually happening inside of the amniotic sac, and but it still can cause shock. Okay, so you may not have external bleeding, so just watch for those signs and symptoms, and that description of severe pain, and watch for those warning signs too. Now we're going to go on. I'm going to talk about this next one here, and these are just notorious topics for National Registry as far as their test questions. So that's why I wanted to spend some time with them. So I'm on page 1188 right here, and we're talking about this word, placenta previa. Okay, now let's go down to the bottom of the column here, and we're going to show this picture. Now, in this picture, you can see that the placenta has actually developed over the cervix. Now, that opening there is the cervix, right? Okay, and that's where the fetus is during birth is going to pass through the birth canal. Okay, but during development, the placenta itself grew over top of the cervix. Now, this could be completely over the cervix, or it could just be partially over the cervix. Regardless, this is going to be a complicated pregnant or complicated delivery, and if this is caught with prenatal care, this patient, depending on how severe this development is, or the position of it, probably is going to have a C-section. Okay, so again, with good prenatal care, this is caught with an ultrasound, and they watch this closely, and as we're getting close to a due date, they're likely to go ahead and induce, so we prevent any problems like with this. But here's what you got to keep in mind. Not everybody has good prenatal care, and there's not very many signs that this is going on except with an ultrasound. So it's very possible that you could find yourself in a delivery situation where the placenta is in this position and you are experiencing, or the patient is experiencing, a very high amount of blood loss during delivery. It's a true emergency if this happens. Make sure you treat for signs and symptoms of shock and call for ALS intercept if possible. This does not mean the baby's not coming. This is just another complication. The placenta could it could rupture, and now on top of that, baby's coming sometime later. So keep that in mind. The big differences between placenta previa, which is this picture, and I'm going to turn the page, and abrupto placenta. Remember, abrupto placenta is the separation of placenta from the wall of the uterus. That it could be caused by severe hypertension, which is preeclampsia, as we know, or it could be trauma related. And with placenta previa, it is a developmental situation here, with the placenta itself grew over the top of the cervix, and with good prenatal care, this is probably going to be a cesarean born baby. Take some time and look over this. I even encourage you to take a look at some outside sources too. Your book doesn't give you a whole lot of information right there about these topics. I kind of throw them all in together, but I'm telling you, National Registry really likes this, and if you're caught on the scene with this type of patient, that's not a good time to go back and review. So be familiar with these things. I'm gonna make another video where I zip through this chapter really quick and just point out some other highlights that I think are important.